The latest HIV/AIDS prevalence report by the Uganda AIDS Commission indicated that Mbarara District was registering the highest number of infections, giving it the country's second highest HIV/AIDS prevalence rate behind Fort Portal. According to the latest figures, the district has registered 1,789 new infections in the last 3 years, translating into 414 new infections, which has seen the district's HIV/AIDS prevalence rise to 9.6% of the district's population. This compares with a national average of 5.5%.
We received more than 40,000 new patients. And when we get that one against the total population minus the people living with HIV, we find the incidence is beyond 5%, which is beyond the level of epidemic control.
These new infections have been registered majorly in teenage females and men in the advanced ages.
At the age 15 to 29 females, we got a higher number of new cases. And as age advanced, up to 40, you observe that men are getting new infections.
We have quite a number of trucks passing through the city. We have commercial sex workers coming from all over, ranging from Rwanda to other districts, who come to stage in Mbarara to do commercial sex.
This scenario is now mostly blamed on poverty that has exposed young girls to unsafe sex in order to make ends meet.
We have quite a number of youth who are not employed. They are all over in town. Most of them don't want to go back to the villages. And as you know, when we come to town, the standard of living is high, and therefore they are looking for survival. One of the routes where they are looking for survival is through sex.
The majority of sexually active young people have also not been properly sensitized on the various HIV prevention methods, including HIV self-testing, intended to deter infections.
It points to our communication strategy, the tools we use to educate the public about these new tools, which is mainly through TV, through radio, even print media. We had hoped that university students access these freely, these channels of communication, but it points that actually these channels of communication are not well reaching these students or this population group.
Dr. Byamukama points out that the recent spike in HIV/AIDS infections are frustrating government's plans of halting the spread of the disease by 2030. However, in order to remain on track, government now hopes to launch a new method of HIV/AIDS prevention.
Starting from next year, we should be able to give you an injection. That means 6 injections in a year. And it's a quite highly effective tool that even if you stay exposed to your risk, if there's nothing you can do to minimize, to reduce your risk, it will help you not contract HIV.
Statistics from the Uganda AIDS Commission indicate that Uganda has registered over 52,000 new HIV/AIDS infections since the year began, despite efforts by the Presidential Fast Track Initiative to end AIDS by 2030.